Hi there, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. Today I want to talk about 5 easy things that you should do before you become pregnant to help prepare your body for pregnancy. So this is just going to be your step-by-step guide for if you're considering on getting pregnant sometime in the not so distant future, and I want to encourage you to think about it for further in advance than you may be otherwise used to thinking about pregnancy. So 100 days is the amount of time that it takes for a follicle in the ovary to develop from that follicle into an egg that's ovulated, that then could be fertilized and implanted to become your baby. So you want to make sure you're taking care of that follicle right from the earliest stages of its development and providing it with the nutrients it needs and the environment to grow in that's healthy and that's going to help allow it to develop to its best possible egg. So the first tip that I have is please kick your bad habits at least 4 months before conception, at least. The first habit I want to talk about is smoking. This is something everybody knows not to smoke through your pregnancy, but quitting smoking can be very difficult. So your naturopathic doctor can provide an integrative approach to help you reduce those cravings and eliminate your smoking well before you start to try and get pregnant. The next thing that I want to help you quit doing is drinking caffeine. Caffeine, even just 1 cup of coffee per day, can cut the chances of conception in half. It can also affect your partner, so it can decrease sperm mobility and motility. It can also reduce his sperm count. So again, have your partner cut out coffee at least 4 months before trying to conceive. You guys can join in together and drink herbal tea or something like that. It can become a habit that the two of you do as a partnership. So the other thing that I want you to quit doing is drinking. So drinking alcohol at any time in your cycle, not just when you're ovulating, can decrease the chance of conception by about 50%. And that's something that doesn't just affect that single cycle, but the alcohol can have effects for about 3 cycles down the line. So again, that's why we say about 4 months before you try and conceive, you should cut all the alcohol out of your diet. The fourth thing that I want you to stop doing is smoking marijuana. THC concentrates in the ovaries and the testes. So decreasing your chances of getting pregnant, again, it decreases your fertility, but it also has tons of other effects on the body. The first thing is that it increases your risk of miscarriage. It also increases your risk of having a preterm delivery, and as a result, your chances of having a smaller birth weight baby are higher. All these things basically set your baby up for a harder start to life. So again, you want to avoid this. So also smoking marijuana can result in chromosomal abnormalities in the baby, meaning a higher risk of developmental difficulties. These 4 different habits can all be difficult to quit, but speak to your naturopathic doctor and we'd be happy to help with providing ways to reduce the cravings, to give you alternatives, and to give you better reasons for why this is so important to quit doing before you get pregnant. The second thing I want to suggest as your tips for pregnancy is to do a cleanse. So we're bombarded with toxins every single day. It's in the air we breathe, it's in the food we eat, the creams and the shampoo and the soap that we put on our skin and in our hair. These are all toxins that are incorporated into the body, and oftentimes these toxins will concentrate in our ovaries and in our testes. So please see your naturopathic doctor for a cleanse that's right for you. I typically don't recommend water or juice cleanses as they can do more harm than good. Especially, please don't do a juice cleanse or a water fast without the consultation of a healthcare professional because they can be quite dangerous. But generally, a cleanse may involve removing the toxic insult from your body in whatever way possible. So this means removing dairy, sugar, gluten, processed foods, whatever you are able to do within your own limits, within your own abilities. You never want to push yourself too far, but you do want to remove all these things for at least a period of about 4 weeks. And then you also want to increase your body's ability to detoxify. This can mean sweating, go to the gym, go in the sauna. This can mean increasing your liver's ability to process these toxins by taking supplements that can be recommended by your ND. There are also lots of different types of cleanses that I speak a little bit about in my video blog on detoxification, so take a look at that if you'd like. But some cleanses can include a yeast cleanse, a liver cleanse, a hormone balancing cleanse, or a GI healing cleanse or a gut healing cleanse. And all these things can be, again, made specifically for you for your needs by your naturopathic doctor. This basically helps to set up your body by taking out all the toxins, or as many as possible, and by making sure that the follicles can be developing in a nice clean environment. The third tip that I have for you is to please start your supplements 100 days before pregnancy. Again, this allows the follicle to develop properly, but it also gives your body time to replenish from anything that it's depleted from. So the prenatal vitamins are a big point of contention with me. A lot of the prenatal vitamins that are available from Shoppers Drug Mart are often recommended, such as the Jameson brand or Materna by Centrum or Pregvit are often commonly prescribed. They're better than nothing, absolutely better than nothing, but typically they have a lot of additives in them. Those are things that you don't need, and they can be harmful to the body. Coloring, for example, is something that's ridiculous. Why would it be in a prenatal vitamin? It also often has forms of the nutrients that are poorly absorbed by the body. So something that is an example of this is folic acid. Folic acid is something that approximately 60% of the population has difficulties with processing, and 10% can't even absorb it at all. And this is due to a genetic variation in our population base. So you can do your genes, you can get them tested. We're happy to do that here, but the other thing you can do is just take methylated folic acid so that you bypass that whole system and you're ensuring that your body is absorbing the folic acid the way that it needs to be. Most prenatal vitamins don't contain methylated folic acid or MTHFR, but some do. For example, my favorite right now is Prenatal Sap by NFH. This is a product that has no fillers, no additives. It's has high doses of all your nutrients, so you're actually getting enough. Many prenatal vitamins have like 1 milligram of B1, and that's not going to do anything at all. So you need to make sure you're getting the correct doses in the prenatal vitamins as well. The next supplement that you want to start taking is fish oil. Fish oil, as I've spoken about before, is omega-3s, and these omega-3s are something that your baby's brain needs to develop. And if your baby's brain is trying to develop and you're not getting enough omega-3s in your diet, which most of us aren't, your body is going to preferentially give things to your baby and take them away from mom. So it's a good thing. You want your baby to be as healthy as possible at whatever expense. But what this ends up doing is it causes memory problems and brain fog and fatigue in mom, and we want to prevent that. So you can take fish oil to do so. The third supplement that I recommend people take are probiotics. You can watch my video on probiotics. I have a lot of opinions about what makes a good and a bad probiotic, but basically there are 3 major meta-analyses that show that probiotics reduce your child's chance of getting eczema, asthma, and allergies, which are your atopy conditions, by about 10 to 20%. These conditions are really common and prevalent, and all you have to do is take a simple probiotic. It does tons of other great things, but it also will help to prevent future illness and disease in your baby. The next thing I want to talk about in your steps to having a healthy preparation for pregnancy is to take your diet and lifestyle seriously. A lot of us talk about, yeah, I'm going to eat healthier and I'll do that later, but you really do need to start this 100 days before conception if you can. This means eliminating all processed foods and foods high in sugars, ensuring you're getting good sources of fats, good sources of protein in your diet, making sure that you are exercising. Exercise will help to keep your blood sugar stable. Exercise will improve your mood. It will improve your fatigue. It will also strengthen your muscles, and it will help you through the laboring process a lot better, which everybody, of course, wants that. The next thing is that you need to lose or gain weight depending on where your weight is. Some people are underweight, and both these things are very important to ensure that you have a healthy pregnancy. If you're underweight, you're at risk for not being able to carry to term and not ovulating. If you're overweight, you're again at risk of having a preterm delivery, of having preeclampsia, of having gestational diabetes. So please take your weight seriously. You're not trying to lose weight during a pregnancy. You need to do this before you get pregnant. Finally, you need to reduce your stress. This is something you, again, need to take seriously. Do whatever it takes to get that stress out of your life. Find ways of coping. Find ways of finding personal time for yourself in order to cope with your stress and reduce those stress levels. It's something a lot of us push under the rug, and we try not to, we don't take it seriously enough, but we really do need to if you're trying to conceive. My final and fifth step for you in preparation for pregnancy is to see your naturopathic doctor. So your naturopathic doctor can do testing to make sure your body has the nutrient levels it needs. For example, vitamin D testing, which is not covered by OHIP anymore, your B12 testing, your iron, testing for anemia, making sure all these things are in place. Can also recommend doing a thyroid panel, a hormone panel, and also looking at your cortisol levels and your food intolerance testing. There are lots and lots of words I'm throwing at you here, but if there are things that are ringing bells, you can feel free to contact me and I'll give you more information about those tests. But basically, you want to make sure your body is in an optimal position before you try and get pregnant, if you can. So the second thing a naturopathic doctor can do is they can take a long, hard look at the medications that you're taking, and you and your ND can decide if these medications are things that you really should be taking throughout your pregnancy. Mother Risk is a really great resource for learning more about that. And then your naturopathic doctor can work with your MD. Your naturopathic doctor is not authorized to take you off of any medications, but your MD can work together with your ND to reduce the doses of your medications and get you off them if possible and if necessary to ensure that your baby's going to be born happy and healthy. Some common medications are anti-anxiety and antidepressant medications that naturopaths can give you other things to help to balance out your mood and help reduce the difficulty of going off these medications, again under the supervision of your MD, but these medications can sometimes have very serious effects on a developing baby. So I encourage you to, again, contact Mother Risk, contact your ND, and take a look at that. Finally, your ND can recommend an effective probiotic and prenatal vitamin and fish oil and give you support to help reduce your stress and improve your eating habits and your sleep habits so that you can make sure your body is completely 100% as healthy as it possibly can be before you try to get pregnant. So this video is meant to be a guideline and a resource for people who are planning a pregnancy. Please make sure that you're not coming down on yourself if you're unable to do these things. And, lots of babies are born without doing any of these things at all, and they're perfectly happy and healthy. Again, this is just to try and give you every single edge that you possibly can to try and have a healthy and happy pregnancy and a healthy and happy baby. Please speak to a healthcare professional, though, to make sure that these steps are right for you and that you can address any other health concerns that may be affecting the health of your pregnancy. So I hope this was helpful for you. If you have any questions at all, please feel free to contact me on Facebook or through my contact page on my website at hilarybooth.com. I'd be happy to also see you as a patient. You can call our office and book an appointment there, or you can go to my website and you can book your appointment online. Thanks very much for watching, everybody. Take care.